Also to let you know that the webinar is being recorded, so you can access it or your coworkers can access it later, and we hope to post it on our United Way website and the Child Poverty Collaborative website. So to get started, I'm just going to introduce the presenters today. My name is Lucy Crane. I'm with United Way. Ross Meyer, VP of Community Impact here at United Way, is presenting. Amy Weber, who is the director of our Two Generation Steps program. Brandon Bennett, who is an QI improvement coach with the Improvement Science Consulting, and Sherry Wooten with Children's Hospital Medical Center. So I'm going to turn it over to Ross Meyer.
Good morning, everybody. Happy to be with you virtually. I'd like to get us kicked off and provide a little bit of background before we jump into the specifics around one-to-one and the learning approach that we're taking, to provide a little bit of context for those that don't know about the Child Poverty Collaborative and our strategy overall. So as many of you know, the Child Poverty Collaborative was convened about 18 months ago. It's a broad-based, community-based coalition of government and business and civic leaders that have come together really around the pretty audacious aim to help move in 5 years 10,000 kids and 5,000 families out of poverty in Hamilton County. And as many of you know and participated in, we had a whole series of community listening sessions last year, more than 80 community conversations, 2 large summits, as well as research conducted by the RAND Corporation that helped really inform the strategy that we're now acting on now. And this summarizes some of the key action steps for the Child Poverty Collaborative and how one-to-one fits within that. On a broad level, we're taking a systems approach because all of you well know that poverty is tremendously complex. The causes and the consequences of it are multifaceted. And we're really focusing on both immediate action to learn with families about more effective strategies and measure their progress towards achieving their goals and moving towards self-sufficiency. And that's the primary focus for one-to-one. But importantly, it's within the context of also focusing on larger systems change, because we know that if we're really going to turn the tide on poverty, we have to address some of the underlying foundational challenges and systems and policies that are holding families back. So you can see on the diagram, it kind of shows the different levels of intervention that we're focusing on within the Child Poverty Collaborative. One-to-one, as we'll get in more in depth, is really about working directly with families, learning with families, and measuring and testing new interventions that can help them achieve their own goals and move towards self-sufficiency. But in the context of also working with employers, we have a tremendous employer roundtable with more than 50 employers that are coming together to share with each other about how they can improve their own practices around hiring, around retention, around training, to provide better job opportunities and stability and advancement for entry-level workers. In addition, we're focusing on larger system change, policy change. We have a policy effort that's getting underway to really help champion public policy change at a local and state level. Right now, actually, a lot of our activities on the federal level, trying to maintain Medicaid expansion. But on a local level, there are opportunities around affordable housing, around criminal justice issues, around on a state level, around public benefits that we can have an influence on. And our focus is really on identifying the highest leverage policy opportunities that we can really mobilize our community around. So it's important, I think, to provide that context. As many of you know, also United Way is taking a big step to focus in on a family-centered approach to addressing child and family poverty. Altogether, our community is really focusing on multiple levels, working directly with families, learning with families, working with employers, working with elected officials to change the trajectory for families in our community. Next slide. Importantly, the approach that we're taking with one-to-one, and honestly throughout all of our work with the Child Poverty Collaborative, is really a learning approach, because as many of you know, many of you that have been working on this issue for decades know that it's tremendously complex. There are no simple solutions. to the reality of more than half of our kids in our community growing up in poverty. While we have many good efforts on the ground, there's not a clear one path forward. So we're taking what we're calling a learning approach. We're going to go in much more depth on what this approach means, but it's really about changing how business is done. I mean, business as usual, as we all know, isn't sufficient. So we really want to come together as a community of families and those that serve families to learn together, to share what's working, what's not, to measure our success in a similar way, and to fail fast and learn from it. That's really the approach that we are trying to take, because we know that there are no simple solutions. Many of you have seen this diagram on the right. It's a system map that we've generated through all the community conversations through the Child Poverty Collaborative last year to really emphasize, as you all well know, how complex this issue is, and really a recognition that if we're going to make progress, not only does it have to be collaborative and coordinated, but it's also got to really focus on more holistic approaches that put the family at the center. So the learning collaborative approach, as you'll hear, has been used in many other sectors as a proven method for learning quickly and learning together to identify more effective strategies that can be scaled to a much larger population. So with that, I'm going to turn it over to our colleague Brandon Bennett, who's working with us on the overall quality improvement and learning collaborative approach. Brandon, we're fortunate to have, has deep experience in quality improvement around the world, frankly. He serves as the principal advisor for Improvement Science Consulting, began his career in the Peace Corps in Uganda, and has since done a lot of improvement work in a variety of settings in healthcare and education, currently working with Carnegie Foundation and Institute for Healthcare Improvement. We're fortunate to have Brandon, as well as our friends from Children's Hospital, helping us to learn how to learn with you about how to tackle this problem. Brandon.
Good morning, everybody. It's really lovely to be with you, and thanks, Ross, for the introduction. I guess my role in all of this is to really talk through the strategy that Ross just laid out. What is the structure that we can use that would allow us all to learn together collectively and to sort of move together towards solutions for poverty? And so what I'm going to walk through over the next few minutes is what you see on the screen. It's something called a Breakthrough Series Collaborative Model. This was a particular model that was created in the mid-1990s by an organization called the Institute for Healthcare Improvement, based out of Boston, and whose sole purpose has been to really think about how to improve the quality of health and health care in communities around the United States and around the world. The sort of reason that this particular method was first created was because there was a great deal of frustration in healthcare at the inability to spread good ideas, known best practices to a wide scale, to the most hospitals, most healthcare institutions, to allow for the maximum number of people to benefit from those services and those innovations. And so we're going to sort of use it for a different purpose. We're going to use it as a structure for learning. We're going to use it as a way to sort of not spread ideas through a healthcare system, but rather to spread ideas through a community system, to figure out how we can best work with and assist the families that live in the community here to move out of poverty. And there's a few different phases I want to talk through. The first one on the far left-hand side of your screen there is called the design phase. And where you see the circle is sort of where we are today. We're really in a process of recruitment and enrollment of interested organizations and community-based teams that would like to go on a learning journey together, that are interested in pursuing a common outcome, a common aim, if you will, of reducing poverty, and would be willing to share with each other the lessons that they're learning on that journey. And so there's some ways that we can do that. One way that we do that is through chartering our work. It's sort of, a charter is a way to sort of set the destination and start thinking about what are the structural elements that would allow us to learn together. And so we'll look at how to do that in the coming weeks and when we get together for our first learning sessions and so forth there. But right now we're just in the process of saying, who's interested? Who wants to sort of do this work together, and who wants to work on improving the system together? The place that we have been over the last few months has really been in the development of a framework. It has involved gathering together people from the community, leaders, different organizations, into a design team to think about what this structure will look like, how frequently we should meet, what our sort of common vision or common destination or common outcome of interest will be, what sort of measures might help us to understand if we are moving in the right direction as we go. And so we've had a bit of time to do that, and we're going to continue that process prior to the launch of what comes next. And so we'll talk more about this, but in the coming weeks and months, we'll move into an implementation phase and a scale phase. And I'll talk to those in more detail a little bit later in the call. But just in brief, the implementation phase is a long period of time, between 6 and 18 months, where we really will engage in a learning journey. Any participating organization will get to sort of say, here's a set of ideas that we think would be beneficial to the community members whom we serve. And we'd like to try those in practice on a small scale in a safe-to-fail way that would allow us to sort of learn what works and what doesn't. There's no expectation that anybody has a known solution right now. What we're trying to do is create an environment where we can try things, figure out what works, and then take what works and see where it's applicable to all. And so that's what the Breakthrough Series structure is meant to convey. And that's what we'd like to get to, so that in 18 months' time, we will have a set of ideas that we feel like we could take to a large scale and that we believe very strongly and through the collection of empirical evidence would actually deliver the outcome that we want to see for our community. With that, I'm going to turn it over to Amy for just a moment, and then we'll come back to more of the details.
Great. So, excuse me. So, as Brandon was mentioning, that since March, we've been working with a team of partners to help create the structure of the Learning Collaborative. And so on your screen, you'll see who was involved in that. I want to specifically call out that 2 co-chairs of the Poverty Collaborative were very active in helping us think through this, and that was Mayor Cranley and Michael Fisher of Children's Hospital. In addition, we had families involved who were giving us input on the subcomponents that I'll be talking through. So, as Ross mentioned, this work of the Poverty Collaborative is specifically targeted to work directly with families. And we've been tasked with touching and working directly with 5,000 families, 10,000 children over the next 5 years. The design team helped us create a really broad system-level theory of change. And so that's what you're seeing on this screen. And this is really trying to take a look to say, from a system-level view, what needs to be true for families to be able to improve their stability and their income. And so you're seeing really big systems-level issues around ensuring that there are pathways to employment that provides livable wages. You're seeing removing barriers in policy. So this is our system-level theory of change. Some of this will be more directly touched by the members of the Learning Collaborative, and some of this will be really making sure that we're connecting with the other pieces of the Poverty Collaborative that Ross mentioned, such as that HR roundtable and the policy team. An important part of the design team was to really lay out the principles of how members and partners will be working together. And those are really the principles of the Learning Collaborative. So, in addition to some of the basics of making sure that partners are aligning to the vision and mission, we also want to make sure that as a group we're creating an environment that has a bias towards action and innovation, challenging sort of business as usual, being family-centered, and making sure we're really being outcome-oriented and bringing community voice and families to the table to learn with us and help co-create. There has to be a commitment to learning and sharing, which Brandon in a few minutes will mention some more specifics about what that looks like. There's elements of being transparent with data, which is key to the learning process as we learn and share together. The design team also helped us think through what were the core common measures at a minimum that members need to be measuring together to make sure we're able to track against improvement of income for families, but also track around other important elements that are key to making those, to seeing that increase in income. So as a collaborative over the next 18-month period, we've set a goal to touch 500 families and to increase their income and stability. You'll see that there's still an X. We haven't determined what that dollar amount or percentage of change needs to be, and that's going to be dependent on collecting some baseline data to really understand the families that we're working with. But the common measures are that high-level measure to make sure we're measuring the federal poverty level of each household. So we'll be looking at household income and the size of the household. And then underneath that, the design team really said, well, that's going to be hard to see change on a regular basis, right? Since it's measured sort of from a big number, well, what's something that could be measured more frequently that might show dollar amounts to really understand what do families have available to them? So with that, we decided that it would be important to measure net income, which would be specifically looking at the family's budget to say what income is coming in and what are the expenses going out. And then below that, you'll see with this number 3 is also taking a look at a self-sufficiency measure. So the subgroup from the design team that was working on the measures really continued to struggle with, and families who were present, really strong voices to say, income isn't everything. What also matters is us feeling safe in our community, balancing things like benefit loss, understanding the support of throughout the community and of friends and family, understanding what their transportation situation was like. And so the self-sufficiency domain, it's a series of domains that really look more comprehensively at different domains that a family is dealing with on a scale traditionally of 1 to 5, 1 sort of showing measures that tend to indicate a crisis position, and 5 measuring what would be thriving. And we've looked at adopting a domain that provides a 1 to 10 scale, so it allows for some more incremental movement to be able to really track smaller changes that are still really important and can be indicators to changes in household income in the future. So that'll be a measure that we're going to learn and use as one of our key sort of drivers of the learning. So with that, I'm going to pass back to Brandon, and he's going to go into depth about that commitment to learning and sharing, and specifically what that involves for the members that will be joining the Learning Collaborative.
Thanks, Amy. So I think you may be starting to get the sense that this is a real different way of going about improving your systems. And indeed it is. I think generally in the sort of history of management and so forth, this is really a quality improvement type approach. It's an approach where we're looking at applying methods of continuous learning to the systems in which we work, to our organizations and to our community systems in order to discover solutions. It is, as a result, it sort of comes with a slightly different language. And so there's a lot of like new words that may be unfamiliar. Things like the use of aim statements and common measures, and up on the screen you'll start to see things like PDSA cycles and so forth. I don't want you to worry too much about the words right now. For those of you who ultimately do decide to participate, we're going to have a lot of time together to sort of do the translation, to figure out what the words mean, what the methods are, and how we apply them in practice. But what I do want you to focus on is that there are some key activities that allow for the structure of a Breakthrough Series collaborative to be successful in discovering changes to the status quo that ultimately deliver the outcome that is desired by the people participating. One is around sort of the work. So I like to say that improvement isn't free. You know, all change that results in improvement comes at some kind of cost. And for us, that cost is going to be a little bit of time. And so one of the first commitments that we're going to ask for is that teams be willing on a weekly basis to meet together and to talk about the improvement journey that they are on, to sort of plot what their next tests of change will be, to think critically about what might work for a particular family or set of families, what might work to change their system in a way that is successful. Knowing that not every change will work, right? So doing so in a way that allows you to learn quickly and is safe to fail. So we sort of say that the minimum commitment threshold is about an hour per week to this work. And if we can't do that, if we can't meet that, we know that we'll be probably unable to really learn new things collectively, and we'll be unable to progress towards the outcome of interest. We also know that that learning really is a scientific endeavor, right? It is a process of like trial and error that happens. And so our sort of way of applying scientific thinking and practice is something called the Plan, Do, Study, Act cycle. And as I said, we're going to learn more about that. But we're going to ask teams that participate in this collaborative to sort of do one cycle of learning per week. So we're going to ask them at a minimum to try to do something different, something new, however small, to gain new knowledge about the system, about the community, about the families, about the interventions that might work. So again, if we can't try something new on a regular basis, if we don't have the ability to do that, then we're unlikely to get movement. We're unlikely to sort of gain new knowledge that'll progress the whole collaborative, that will progress all the teams in a way that really moves families in the direction that we desire. A third sort of commitment that's really critical for us is the use of data. And so that could be quite a scary thing. I know I'm somebody who had to repeat algebra twice in high school, so it's always a little scary thing to think about the use of data. But for me, the use of data on a regular basis has become something that I'm very interested in, because it allows me to see objectively whether or not change is occurring in a direction that is positive and helpful. And so it allows me to move beyond belief, to move beyond sort of my gut instincts, and into something that I can share with others and can say definitively, empirically, you know what, when I do this with families, I get a better result. And that's what we really want, because collectively, as a group of teams, we want to be able to say, here are the 5, the 10, the 15 things that if we do them, we are assured that we're going to help our community in the way that we intend. And so we're going to ask you to collect the data that Amy was describing earlier, and there may be some other data that is really useful for you as individual organizations that we ask you to think about and to report on. And we want to learn with you what that is and how we can use it together to effectively understand when improvement is occurring. A fourth thing that may be helpful to you, one thing that we would like to offer and help to create, is an environment where you feel supported. And so part of that commitment is to look at how we might provide quality improvement coaching to your organizations. And so on a regular basis, we're going to be looking for and hopefully finding some volunteer quality improvement coaches that would be available to you at I assume, no cost other than time, and would be able to sit down with you and work through some of the logistics and specifics of applying quality improvement methods in your organizations and with your communities. And then finally, the place where we sort of gain momentum, we gain energy, where we gain new knowledge, are in these collective sessions that we refer to as learning sessions. They will happen sort of on a quarterly basis, every sort of 3 to 6 months, and we'll all come together in person. And the intention here is for us to do some of the translation work, to learn some of the new tools that quality improvement can provide to us, but also to share with each other what we're learning. To sort of say, here's what we as an individual organization have discovered about working with our community in the last 3 months. And here's what we can offer back to the community. And so it's a chance to celebrate what's happening within the collaborative and to understand our sort of collective work and to really learn from each other and ask questions of each other. And so we'll do that. So these are going to be our 5 sort of big commitments going forward. To that end, our structure is really embedded in the diagram we were looking at earlier, but there are a few different sort of roles that might be interested to see. One is the executive director and co-chair of leadership, which is a position that will exist here at the United Way, as well as a project manager. And these will be the main sort of touch points for the collaborative. All the organizations will be able to interact with them on a regular basis. Any sort of questions and so forth can be funneled through them, and they'll be a real helpful set of people to really take this work forward. My name is Brandon, as you all know, and I'm sort of the quality improvement advisor, that middle sort of deep blue circle on the left-hand side. And I'll be there to work with the local quality improvement coaches, to work with the teams, and to work at this sort of hub level for the collaborative to make sure that the learning system that we're creating is successful. And so I'll be available to all of you and very, very happy to share insights wherever possible that I can. The sort of light blue circles represent the teams that will choose to participate. And these will be the member teams out in the community that are direct service organizations or work in the community who really want to try to evolve and change what it is that they do in order to be more effective, more efficient, more timely, whatever the case may be in serving community members. And the quality improvement coaches are individuals who will come from the community, who have quality improvement knowledge and skills. They may come out of industry, they may come out of healthcare, they may come out of education, and they will be available, as I said, to sort of support and guide and offer advice along the way. What this looks like in practice, I wanted to share a couple of stories with you about what it looks like in practice. So I've had the opportunity to work on a number of collaboratives around the world, and most recently working on one that is dealing with trying to reduce poverty in the region of northeast Wisconsin. That collaborative is called POINT, and it is being led by 2 different organizations. One is called the Institute for Healthcare Improvement, which I mentioned earlier in association with the creation of the collaborative model. The other is a consortium of local philanthropic organizations that work to reduce poverty in their own right in the region. And after many, many years of struggling with seeing an increasing poverty rate and strangely a decreasing unemployment rate, they decided to take collective action, to sort of pool their resources and create a collaborative where organizations could come to learn. And so for the last 18 months, the POINT has been functioning in the sort of greater Green Bay, Kimberly, Appleton, Wisconsin area to think critically about how we might reduce poverty in the region. And there have been 2 main strategies that the teams have employed in order to successfully lift families out of poverty. One is for individual organizations to really get better at doing what it is that they do. So for organizations, for example, that help families and individuals into permanent housing, it's to get better at that. Maybe to be able to do that faster or to process more individuals into permanent housing. It's to sort of improve on the outcomes that are meaningful to them as individual organizations. And I think we're going to adopt a similar strategy here with CPC, and we're going to look at how we can work together to use tools and methods from quality improvement to get better at doing what it is we do. The other strategy that we have is collective action, is to sort of draw together groups of organizations that maybe individually work with one or two key issues associated with poverty, but who collectively deal with many, many issues associated with poverty. And so when we identify individual families who are struggling and we identify the various and complex needs they have, to create a pathway where they can have each of those needs served simultaneously in an effort to sort of lift the entire family, to not be held back. Where, you know, a good example I guess I could think of from Wisconsin is when we, for example, identify somebody who is homeless, they may be chronically homeless, they may be a veteran, they may have mental health issues, they may have a need for job placement, and it may be 3 or 4 different organizations that need to work collectively to sort of solve all of those issues in partnership with the individual themselves in order to assist them out of poverty. And so we'll look at how and which organizations might choose to opt into that and do that, and how we might work together. We also have some examples of collaboratives right here in Cincinnati that have been going on. And so I want to invite Sherry to sort of dive in here and talk about what's happening even just this week where collaboratives are ongoing.
Thanks, Brandon. So Brandon was hinting at something happening this week. There is a collaborative called All Children Thrive. And our global aim, if we think of the vision here, our global aim is that the children in Cincinnati are the healthiest in the nation. And you can imagine that would be lots of people involved to make that happen. And there's kind of 4 big areas that we're focused on improving. And the first is that children live to their first birthday and beyond. So we have a high infant mortality rate in Hamilton County. 90 children die per year before their first birthday. So that's one. The next is then, you know, I'm healthy, I'm at my first birthday, so how do I have a healthy mind and body as I progress along to 5 and I'm ready for school? And there's a couple of things in there that are important. Some are kind of more what you would think traditional healthcare. Can I see? Can I hear? Great. Can I speak? And some are actually addressing disparities in our neighborhoods around the health of children. So we know that our least healthy neighborhoods, children are anywhere from 10 to 40 times more likely to be hospitalized. So how do we go about addressing those disparities? And then the last one is reading by 3rd grade, which is a great indicator of the health and how our children are doing in our community. But what's fascinating, when I say those 4 things, you could almost imagine maybe 4 siloed improvement teams, right? But what we've really found to be true, and why we had this learning session with all 4 improvement teams focused in those 4 areas, is that we actually have a lot more in common than we have different. So what I mean by that is everybody, when they're going to solve these things, and I predict this will be true for you, and the power of why working together is so important, everybody is figuring out how to develop trusted relationships. So it's something that every team, no matter what their goal is, it's something they've got to figure out is how to get quick and trusted relationships. Every team looks successful for the people that walk through their door, but it's the yet to be reached. It's the people that don't walk through the door. And so oftentimes in our programs, we measure who walks through our door. But when we're looking at an entire community or entire population, we've really got to understand who's not walking through our door and how we reach them. So we often call it yet to be reached. And another thing that we're co-solving together is, this one sounds so basic and so obvious, yet we often don't do it, is co-creating with the people who are receiving services. So in our case, families and children. And how do you co-create? How do you come up with solutions that are really informed by our families and children? And fascinating enough, the people who helped us come up with that, they call it the recipe for inclusion, were our families and children. We were really tripping about how we do that. And they came up with this very simple recipe for inclusion that we're all using now that's helping us. So I'm pointing it out, and I think Brandon and Amy asked me to talk to this because sometimes as you think about the member teams, you know, and are you going to join, you might be thinking inside your organization, and I've got to work on these things, and what would be the benefit of being in a collaborative? But within a week or 2, I think you're going to realize where you have all the commonalities and where you can quickly learn together. Anything else there, Brandon?
No, that was fantastic. Thank you. So we have this structure that we've been talking about, the Breakthrough Series structure, and starting in the late summer or early fall, we're going to really get going with the first learning session, and we're going to start learning the specific tools and methods of quality improvement. And perhaps most prominently among them is we're going to learn about something called the Model for Improvement, and that is a tool that we use to apply scientific thinking in an operational space. And so the first sort of phase that exists during the implementation phase, during our sort of first part of our quality improvement journey, we're going to focus on really working with a very few number of families to learn as much as we can about what it takes to move someone out of poverty or to move a family out of poverty. Whether that is the action of a single organization or whether that is the action of a collection of organizations. And so we're going to sort of start small and move fast. We're going to have some experiences where things work well, where they don't work well, that's okay. We're going to create a safe to fail space where we get to innovate amongst each other and inside of our organizations in order to discover what works. During the second half of the implementation phase, we're going to start to spread out those ideas. We're going to be learning together the use of the methods of improvement, and we're going to be learning together the individual applications, the individual ideas that actually move families. And so we're going to spread those out in a way and figure out which things are sort of universally applicable, which things require some local adaptation, and we'll do that. And so that'll be the second half after our second and third learning sessions. And then eventually what we'd like to arrive at towards the end of the Breakthrough Series Collaborative is, as we said, an evidence-based approach for lifting families out of poverty. And that's really our learning destination. And we'll know that when we see a change in our self-sufficiency scores and when we see a change in how families are living in our community.
So I'm going to cover some processy items just to wrap this up before we open it up to questions. So in order to work through those two phases of the implementation that Brandon was just talking about, we will be using an RFP process. And what you're seeing right now is really just for that first 6 months. So learning deeply with a smaller number of families, 10 to 20 families per team that joins, and making sure we're providing time to really learn all the quality improvement skills as well. So there is funding eligibility. We have a pool of funds currently that are at $800,000 for, again, just this first part, 6 months. Funding is available to support the participation of members of the teams that come together, as well as specifically for testing new interventions. And as you'll see with this first criteria, there will be a preference for using that funding directly to try new and innovative interventions and really thinking holistically around different family-centered strategies to address poverty. We'll also be looking at teams, and I'm saying teams because this could be within an organization or it could be a team, a collaborative team across organizations, to show a demonstrated track record of impact and results, to have experience working with families who are living in poverty, and have experience bringing families to the table, that community voice. We're looking for teams that have the ability to do all the measurement that Brandon was just talking about, to have the support to be able to track the outcomes, although there is a structure in the Learning Collaborative to work with partners as well to make sure that if they need some capacity building, we're assisting with that. There needs to be accountability, and there is going to be a preference for partnerships and collaboratives of providers. And then after this first phase of 6 months, we will have a similar process for that phase 2 of really accelerating and scaling the learnings and the successful interventions from the first phase. Let me give you the timeline that we're working with. So We had the webinar introduction today. The next big event will be what we're calling a launch of the Learning Collaborative, and it'll also be the day that we're releasing the RFP. That's going to be on July 18th. It's going to be a full day session hosted at the Red Cross. And we'll be sending out the specifics of that so you can sort of save the date for that event at the end of this webinar when we send out the link to this recording. And then from there, we're looking at a due date of August 18th for proposals, quickly having a quick review process, and then providing notification to the acceptance teams on August 28th. And what's really important, and what you saw in the diagram of the structure of Learning Collaborative, is that first learning session. So we want to be transparent of this date of August 31st, as anyone who's invited to participate in the Learning Collaborative. This is a really important first day to get together, to learn some QI skills, and to also revisit the structure of the Learning Collaborative, and then to begin to have an action plan for getting started. Then from September through about the end of January, we'll be working on these learning cycles, which will involve all of the commitments that were mentioned earlier. Teams testing rapidly, working with coaches to help support their learning and their QI capacity, and then getting together to make sure we're sharing on a monthly basis any learnings that are coming up, and getting together on a quarterly basis for larger learning sessions. And then in February, again, we will start that phase 2 of the implementation process, that scaling and accelerating the results and spreading them to more families. So with that, we'd like to go ahead and open it up to questions. So what I'm going to do is unmute everyone. So let me get in here and unmute. So if you do have background noise and you don't plan on asking a question, you know, it would be helpful if you would mute your own phone so that we don't get too distracted with background noise. All right, so everyone is unmuted. So are there any questions? Let me check the questions. Yeah. Okay, so we did have a specific question around not seeing any specific mention of community-based primary care reps, and sort of thinking through the role that community health centers and other community-based providers might play in this. Sure, do you mind talking about, or Uma also joined us from Children's, talking about the role that some of the community health providers are playing in All Children's Lives?
So I think we have a number of community providers participating in the All Children's Lives collaborative, and specifically, I think Marilyn Crumpton, the lead from the Cincinnati Health Department, is leading that work along with Mona Mansour. So let me go ahead and send out an email about that to everybody so people are aware of that. If you could sort of, I don't know what the method is for them to send in an email or let us know, and then we'll connect you to the people, because that work is going on and it is going to be very important to help families.
Mm-hmm.
Any other questions from participants? You can just either chat or just tell us what your question is now.
Yeah, this is Pam Green. I know that in the first couple of slides you talked, in your pyramid, you talked a little bit about some of the 50 employers that are coming to the table. Are they going to actively engage in some of these QI teams, or are these kind of two separate things that are going on?
I think this is Lucy, Pam. One thing we wanted to lift up, and maybe we didn't talk about it a lot, is that the different parts of the Child Poverty Collaborative. There's an employer roundtable, there's a policy piece. This is the one-on-one, actually touching families piece. But what we hope is that throughout the process of the Learning Collaborative, we will be lifting up issues that we identify to the other pieces of the collaborative. So we're not meant to operate in silos. And we hope that the work, and Brandon mentioned this a little bit, that, you know, we'll work collectively, but we'll also be identifying and lifting up pieces that possibly the employer roundtable can address, possibly the public policy folks can address, because that's where a lot of the big work's going to happen. Also, some of the QI coaches, we're hoping to pull them from some of the employers that we're working with, and we're starting that process right now.
Great, thank you.
Any other questions? Or anybody want to comment on anything else before we close out?
Brandon, as people think about their applications, what are kind of the important things that, you know, that are important in this collaborative? So what are you looking for in terms of how people will participate and what characteristics they need to bring to the table?
That's a good question. I guess I would, the big thing that I would be interested in would be, you know, willingness to learn, a willingness to try things in a new way. That's the single greatest sort of mentality or mindset that we want at the table. I think beyond that, I think a willingness to spend some time and to collect data, those are really, really critical. Those are the ones that I'm looking out for and want to help people grow those abilities and skills.
So if there aren't any other questions, I don't see any in the chat box. One last call for questions before we end.
Are you all going to send out the slides?
Yeah, so I was just going to wrap up and say two things. One is we're going to send out the link to the webinar, and we're going to add a couple of slides in there as suggested by, I think it was HA. Immediately following this morning's webinar, I want to remind people also we'll send out a save the date and an invite to July 18th. That is when the RFP will be released at that session, and so be thinking about, mark that on your calendars. It's a full day. It's going to be at the Red Cross. We will talk in depth about the RFP, but even more in depth about the Learning Collaborative and how that operates. And so be thinking about bringing a team with you if you're interested in that, because that's really the date. We'd like to see you if you're interested in being part of this. And also, we'll post the webinar on our website, our United Way website, and the Child Poverty Collaborative website.
And if you have any other questions, feel free to email Lucy or this is Amy, myself, or send questions to childpoverty@uwgc.org. And as we get questions too, we'll make sure to disseminate all the answers so that everyone's aware. We're likely starting sort of FAQ sheet around the Learning Collaborative.
So thanks, everyone. We're going to sign off.
Thank you.